Welcome back to the GP Pharmacy Club pod. I'm Adam, your host, joined as always by the brilliant Amanda. Today, we're diving into an essential topic, smoking cessation. With new NICE guidelines on preventing tobacco uptake, promoting quitting, and treating dependence, we'll explore how these recommendations can be applied in primary care.
That's right, Adam. Today we provide practical strategies, real-world implementation tips and suggestions on how GPs and pharmacists can work together to support patients on their quit journey. So grab a coffee and let's get started.
Let's start with the big picture. Smoking remains one of the leading causes of preventable death. The new NICE guidelines emphasize the role of healthcare professionals in reducing smoking rates through structured interventions. Amanda, why is this especially relevant for primary care?
Well, Adam, primary care professionals are in a unique position. We see patients regularly, and even a brief conversation about smoking can have a significant impact. Studies show that advice from a healthcare professional doubles a person's chances of quitting successfully.
And it's not just about the individual, right? Secondhand smoke affects families, especially children. Encouraging quitting means improving overall community health.
Prevention is better than cure. The guidelines stress mass media campaigns, school-based interventions, and stronger retail regulations to deter young people from starting.
Absolutely. Pharmacies and GP practices can support these efforts by engaging with community health initiatives and promoting smoke-free policies in schools and workplaces.
And let's not forget that GPs can play a key role by educating parents on the impact of secondhand smoke. There are also strategies like using peer-led interventions in schools to ensure young people receive credible, relatable messages about the dangers of smoking.
Identifying smokers is crucial. Every healthcare interaction is an opportunity. The guidelines recommend routinely asking about smoking status and assessing nicotine dependence using simple questions like, how soon after waking do you smoke your first cigarette?
And documenting this information ensures we can track progress and follow up effectively. Pharmacists can reinforce this during medication reviews.
The guidance also suggests using carbon monoxide monitoring where possible to give objective feedback to patients. A high reading can be a real wake-up call. So, what works best? The guidelines recommend a combination of behavioral support and pharmacotherapy, such as NRT, cytosine, varenicline, and bupropion.
Yes, and with pharmacists now able to offer stop smoking services, there's a fantastic opportunity for collaboration. GPs can refer patients directly to pharmacists for structured quit programs.
Let's talk about e-cigarettes. While not medicinally licensed, they are still recommended as a harm reduction tool. The guidelines advise that, although the long-term effects are not fully known, vaping is likely to be significantly less harmful than smoking.
Primary care teams should provide very brief advice and refer patients to local stop smoking services.
Hospitals and secondary care settings also have a role, supporting patients to quit pre-surgery, during admission, and post-discharge.
This is where coordinated care is key. GPs and pharmacists should ensure that patients discharged from hospital receive continuous smoking cessation support.
Not everyone is ready to quit in one go. The guidelines suggest harm reduction strategies like cutting down gradually or using NRT to reduce harm.
And motivational support is essential. Keep the conversation open and positive. Even if they are not ready today, they might be in the future.
Harm reduction strategies include temporary abstinence, like when patients are in hospital or in workplaces where smoking is not allowed. Encouraging use of NRT during these times can help with reducing overall dependence. Let's talk about pregnancy. Smoking during pregnancy poses serious risks, and the guidelines emphasize routine screening and tailored support.
NRT can be prescribed safely, and behavioral support is vital. Midwives, GPs, and pharmacists must work together to ensure continued cessation support postpartum.
And for smokeless tobacco users, culturally sensitive interventions are key. Understanding the unique challenges faced by different communities can make all the difference. The guidelines stress using culturally appropriate messaging and targeted awareness campaigns.
Quitting smoking is one thing. Staying smoke-free is another. Continued support, follow-ups, and community engagement help prevent relapse.
That's why combination therapies and structured follow-up programs are so important. GPs, pharmacists, and stop smoking advisors all have a role to play.
Another key point in the guidelines is monitoring medication adjustments. Smoking affects drug metabolism, so stopping can impact dosages for medications like warfarin and theophylline.
That's a wrap for today's episode. We've covered prevention, identification, interventions, harm reduction, pregnancy, smokeless tobacco, and relapse prevention.
And we've highlighted the importance of teamwork between GPs, pharmacists, and the wider healthcare community. If you enjoyed this episode, don't forget to subscribe and leave a review.
Thanks for listening to the GP Pharmacy Club pod. Stay healthy, and we'll see you next time.